Well, Dr. Yonas Tegegn Woldemariam is the World Health Organization representative in Uganda. He now joins us via Skype from the capital, Kampala. A very good evening to you, Doctor. Thank you so much for joining us. Now, the WHO says this outbreak is not enough to warrant it to be declared a global emergency. Now, looking at the rate at which Ebola has been spreading in past incidences, this is concerning, isn't it?
It's concerning, but as the committee has observed, the risk of spread into the rest of the region is not as high as they would have expected. So in that sense, that's why it's not declared it as a public health emergency of international concern.
What then constitutes a risk for such an outbreak to be declared an emergency?
A sustained transmission in a new area and a threat for the other part of the world which constitutes such classifications.
So has the WHO received any funding to counter this outbreak?
It has received funding, but generally speaking, whether in DRC or in Uganda, what is made available is far more less than what is required.
So is Uganda prepared in terms of capacity? Just how well prepared is Uganda to ensure that it contains the spread of this disease?
Uganda is relatively better prepared, especially compared to what was there in August. A lot has been done. We can go into the various aspects. I generally believe that we are better prepared than we were. In terms of surveillance, we have put systems for border screening as well as community-based surveillance. It has a good laboratory capacity to test and diagnose. It has established 8 Ebola treatment units in case it crosses the border, but generally I would say that a lot has been done, and it has vaccinated over 4,700 health workers and frontline workers, and currently it's doing more vaccination with about 3,400 doses of vaccine in the country. So yes, it is better prepared, but a lot is also needed to be done.
Dr. Yonas, let me take you back to the 2014-2016 Ebola outbreak in West Africa, wherein the WHO was heavily criticized for not having declared it as a global emergency until over 1,000 people died. Is this what you want? Is it to want to see more and more, or even thousands of Africans dying for you to declare it as an emergency?
It's far more different than the situation in 2014. A lot has been prepared, and we are on the ground and looking into the situation. As you know, these cases which has come to Uganda has been people who crossed the border after contracting the disease in DRC, and they were identified within a short time, isolated, and were on care by the time the two governments they agreed and to some of the family members to return. So it's not as if there is a sustained transmission which has occurred in the population. We are looking into the contacts, and I believe we are very much better prepared to respond to this epidemic.
We have been reporting in the past that mistrust has been very high, especially in a region that has never faced Ebola attacks before, and attacks by rebel groups are actually undermining aid efforts. Are you also of the same view? Is that what you witness on the ground?
In Uganda and the situation in DRC is quite different. In Uganda, it seems security is stable, while in DRC, the area is affected by conflict and a lot of rebel groups. So the security situation is quite different. And here we can reach communities, and for example, awareness was possible to be for among, we are going house to house creating awareness for over 500,000 households, and through community groups, and we're able to work with local leaders, religious leaders, community leaders. So the trust between the health workers and the community is far more stronger and positive in Uganda. That's why we believe that in Uganda is better prepared and would be able to contain this outbreak.
So as you're moving door to door, raising awareness about Ebola, do you get the sense that many people, especially in Uganda, do consider Ebola as a big an issue as security itself?
Let's separate the issues. This is the sixth time Uganda is having Ebola, and people are aware about Ebola. And partly in this area of Kasese and Kudipucho and Kabaroli, there has been also the Ebola outbreak in 2007 and 8, and people they are aware of Ebola, and we have done a lot of effort in mobilizing communities and creating awareness. So they are aware of the disease. It's not a disease which you will ignore or you will take it lightly. It is a serious disease, and people have done a lot to be aware and take precautions, as you have heard in the interview you have made in Kasese and in Bwera. People are aware and making precautionary measures.
Well, I guess what I'm trying to understand as I'm asking this question, Dr. Yonas, is that we've been seeing reports of people throwing rocks at the WHO vaccination teams. They've been blocking roads, and they've also been looting healthcare facilities. This is very clear that they take security very seriously over the issue of Ebola.
Yes, we take security seriously, and that is why we have also the UN system looking into the security and trying to create and trust with the community in DRC. But the situation is quite different in Uganda.
All right, Dr. Yonas, thank you so much for joining us. We appreciate your time. That was Dr. Yonas Woldemariam. He's the World Health representative, or rather World Health Organization representative in Uganda. He joined us via Skype.